Welcome everyone to today's webinar, Price Transparency and Shoppable Services, What Should Hospitals Do Now? I am Abby Engel with Becker's Hospital Review. We will begin today's webinar with a presentation and we'll have time at the end of the hour for a question and answer session. You can submit any questions you have throughout the webinar by typing them into the Q&A box you see on your screen. We're looking forward to hearing your questions. We will also have a series of audience polling questions during today's webinar. When we reach each poll slide, the poll question will pop up automatically on your screen. Our speakers will give a few seconds for you to select an answer from the options on your screen and click Submit. Thank you in advance for your participation. Also, please note the call to action button on your screen. Just click to schedule one-on-one time with an IBM expert on this and other transformational hospital topics. Lastly, today's session is being recorded and will be available after the event. You can use the same link you used to log into today's webinar to access the recording. At this time, it is now my pleasure to start today's webinar by introducing our presenters. Betsy Block is a consulting leader for IBM Watson Health, focusing on providers. She has more than 20 years of experience in healthcare marketing and strategic planning for community hospitals and academic medical centers. She has architected solution-oriented business development strategy for value-based care and partnered with senior healthcare leaders and physicians on implementation of new models of care. Jim Holohan is an associate partner on the IBM Watson Health Provider Consulting and Analytics team. He has held executive leadership positions for a publicly traded healthcare provider, CEO for a specialty hospital, and COO for a for-profit healthcare provider. His current work involves working closely with health systems and hospitals on alternative payment models, population health, strategy development, and ambulatory and post-acute network strategies. At this time, I am pleased to turn the floor over to Betsy to begin today's presentation.
Good afternoon, everyone. And today we're going to take about 45 minutes to talk about a topic that is of great interest to us as professionals, obviously, but it's also of great interest to us as consumers of healthcare. I would imagine that given the rise in high deductible health plans, it's likely that you or one of your loved ones have had that experience recently where you've become acutely aware of the cost of your healthcare services in a way that we never have in the past. So it might have been while checking out at a pharmacy or at a lab or getting an imaging procedure done. And because of that increase in those kinds of experiences, not only are we as professionals and consumers aware of it, it's also caught the attention of our legislators and our policymakers at the federal and the state level. And we're seeing now even state governments and submitting new bills to address concerns about surprise billing and some creative ways of being able to help consumers be more aware of the prices that their health care is going to cost. So as a result, we believe that this is not going to go away easily, that this trend towards consumerism has already started, and this awareness of the difficulty to be able to comparison shop within healthcare is something that is very real and, as we said, will not likely go away soon. So let's talk about our agenda for today. I'm going to overview the final rule on price transparency and shoppable services and discuss really the key strategic considerations, possible market effects, and then I'm going to hand it over to Jim Holohan, my colleague that we just heard about, who's going to be talking about some strategic recommendations. What should you be thinking about? How can you prepare today? And then also go over some resources that we have available. So let's talk a little bit about the final rule. As you likely know, it came out in late 2019. It was really in response to an executive order that Trump issued in June of 2019. And the goal is to to make standard charges public in order to make it easier for consumers to understand the price of their healthcare services. So what does a standard charge mean? Standard charge is more than the gross charges that are available today. We need to include the discounted cash price, payer-specific negotiated charges, and then a de-identified maximum and a de-identified minimum charge from all payers. So in other words, the highest amount that you would charge for a particular service or the lowest amount. And the requirement is that we produce that information in two formats. So one in a machine-readable file that would include all charges. CMS just clarified that. All services that the hospital provides in a machine-readable format, all those standard charges that I just reviewed. And then also a consumer-friendly format. So hospitals need to provide the consumer-friendly format for 300 shoppable services. And by a shoppable service, that's defined as a service or procedure that can be scheduled in advance by a consumer. Those shoppable services need to be displayed in a consumer-friendly format that's easily accessible with no barriers to access. You can't enter any personal information. At the same time that price transparency legislation was released, there was also a payer version called Price Transparency and Coverage, and it was designed to encourage, it's a proposed rule, not a final rule, and it's designed to have payers make cost information available to consumers as well in order to encourage price shopping. So important to know about the payer part is the proposed regulation is that they make available all of their in-network negotiated rates with all of their network providers, as well as historical payments of allowed amounts to out-of-network providers. Those also available in a standardized machine-readable file. So in other words, the concept is that we as consumers would be able to find our price information directly from our provider that we're interested in, be able to comparison shop on the website of our provider, preferred provider, or we could go to our payer and get the same information. So the other piece of the payer part that is proposed and also interesting is that the legislation is encouraging payers to incentivize consumers to shop. And if they do that by offering cost discounts or other methods, they can take credit for shared savings in their medical loss ratio calculations. So I'd like to pause here for a minute and take our first audience survey. Based on the information about price transparency, is your organization actively preparing for the price transparency final rule today? Okay, here's our poll results. 77% of you are, and that's exactly what we would hope, and that's probably why you're on the phone today, to get some more information about exactly how. So let's talk about the key strategic considerations of price transparency. And the first I want to discuss is really what 78% of you are likely already well aware of, and that's the potential impact of this price transparency regulation on your revenue. Studies have shown that 43% of healthcare spending, which is almost $63 billion, by your commercially insured individuals are for shoppable services. So in other words, 90% of the highest spending outpatient categories are shoppable. That can amount to a great amount of revenue on our hospital systems that are already seeing a large shift from inpatient to outpatient revenue. But interestingly, when we go around the country and talk to hospital leaders about the new regulation, we've heard a variety of different points of view. One is that some hospital leaders say, are we really going to have to do this? Because there's a strong legal challenge, as most of you are probably aware, one being led by the American Hospital Association, and payer organizations are also pushing back on this legislation because of some concerns about really divulging all that pricing and that anti-competitive nature of that. And so there is a sense that these legal actions are justified and that they may possibly delay or even derail or change the way the requirement is enacted. So we also are hearing from some hospital systems, especially those that are in non-competitive markets, that they're saying, well, in our case, we might just take the penalty, right? It's $300 per hospital per day. Maybe we'll just take that rather than divulging all of our, negotiated rates, which might lead to some potential revenue loss. So we're hearing that. And then thirdly, we also heard sort of a level of skepticism from hospital leaders that, prices have been available in essence. Gross charges have been available on our websites for nearly a year now, and no one seems to be shopping. And oh, by the way, our payers have had price estimating tools, many of them, for years, and they report less than 10% of folks are shopping today. So we at IBM Watson Health thought that was an interesting question, and we knew we had one of the largest national healthcare behavior survey that we conduct every year. And as part of that, in November, we decided to gauge the market more around price sensitivity, around shoppable services, and to try to understand, are there certain demographics that are more likely to be shoppers, more likely to shift care than others. And so in November, we ran this survey, and here was the interesting result. 27% of the millennials that we surveyed said that they would switch facilities if they could get $100 to $150 savings on a lab test that they would expect a $200 out-of-pocket cost. So 27% of the millennials we surveyed said that, and 25% of the Gen Xers also said that they would switch. If you take those two categories, the millennials and the Gen Xers, together and think about it, they make up the majority of your commercially insured population today because baby boomers are aging and moving on to Medicare. So, and important for us to consider, there is a significant amount of folks who would be willing to shift. And I think many of you have already, there's a lot of body of evidence around how millennials view their healthcare choices. So this seems a little bit in line because there's an understanding about perhaps loyalty is not the same to the system as we had observed in generations past. But another specifically very sort of counterintuitive piece of information that we thought was incredibly important was that those who were more educated with higher household incomes were the folks who were willing to switch for that amount of money. So sometimes you might assume that it would be someone that was more cost conscious, that would be more price sensitive, but in fact we found it the other way around. So those higher household incomes, more educated and younger, millennials and Gen Xers, are the ones who said, yep, we'd switch facilities, no problem, for that cost savings. So the flip side of that was that the less educated, lower household income, and older populations were the ones who were more likely to postpone treatment. So that's a concern, obviously, if you're taking risk for any of those populations. They're willing to postpone rather than switch a facility. They just wouldn't get it done now if they had to pay a $200 out of pocket. And of course, that's a concern, for us as well. So let's talk about the possible market effects then of this legislation. On the far right, we've talked a little bit just now about, will more consumers shop? Our position is really yes. We believe more consumers are going to shop as this price information becomes more available. How quickly, is yet to be determined. But that move towards consumerism is something that, we've seen in the market. It's happening now already. And then the attention by the federal government and by all the state governments, we believe is going to, encourage more awareness around that availability. So the result there, providers need to become more consumer friendly. Of course, we recognize that in order to maintain or grow this key demographic. But probably the most significant and the one that strikes the most fear in the providers we talk about is what happens to pricing once the veil is removed, once it is clear to all payers, and then the competitive pieces to amongst health systems. If everybody knows everybody's rate, there's going to be a market mean. There actually already is a market mean, right? And those providers who are at the 75th percentile, for example, on a particular service, if they have to, if their charges drop down to the mean, then, obviously there's quite a bit of revenue potential loss there. On the flip side, those who are at the 25th percentile have some upside for a brief moment. But if you think about how that really changes our market, that all the pricing will be at that market mean, assuming that, and then the providers are going to need to compete on other factors, right? Quality, outcome measures, access, reputation. Those are going to be the only ways that a provider can differentiate themselves. And the other issue really that comes out of that, which are the other possible market effects, is that once, if the price is sort of set, then it's going to be a matter for the providers to take a look at their cost structure. And if their cost structure is such that they cannot compete effectively at that particular set price, what we anticipate is that there will be some dramatic changing by the way providers take a look at what outpatient services they do provide. And we anticipate, we've already started to see new entrants into markets, PE-backed independent imaging companies, for example, who do have a lower cost structure, who do take a look at that desirable demographic that's willing to shift providers for incentive. And if they can offer a price because their cost structure is lower and they can offer a lower price, they believe they can get those that desirable demographic of more educated and higher household income millennials and Gen Xers. So what we may see in our markets is non-traditional competitors coming in. It's not just the other hospital systems in your market, but non-traditional. And as a result of that, what we believe is highly likely is that providers They sort of abandon that cradle to grave concept of providing every service to their market, and instead begin to either partner or just exit out of some of those unprofitable outpatient services. So with that, we're going to sort of transition here and talk about, okay, now that it's not that dire, but what do we do about it? And there are some things that we can do. What should we be thinking about? What questions should we be asking ourselves? What kinds of opportunities do we have? And to be able to prepare for price transparency. So I'm going to ask you to participate in another survey question, and that is, does your organization have a consumer-friendly price estimator tool available on your website today? So as you can see, the result, no. Majority of you, 63% of you do not have one, but 24% of you do. So with that, I'm going to transition over to Jim Holohan, who's going to start talking a little bit about those options you have.
Great. Thank you, Betsy, and thank you to everyone for joining us today. So we've gone through a little bit with Betsy's help, the overview of the rule and some of the mechanics in the rule, some key strategic considerations, as well as some possible market effects. And as Betsy mentioned, we want to transition now into this what you should be thinking about part, and what are some strategies to consider moving forward with price transparency in your market. So as we move forward here to slide 14, there's 5 key questions here that we should be asking. So the first question is, which shoppable services are most in demand in your market? In our new world, health systems must have a deep understanding of the consumers in their primary service areas. Health systems must gather data to help them segment populations, not just by demographics and zip codes, but by their behaviors and their lifestyles. Really understanding consumer price sensitivity. So really, I look at that first question as sort of your market intelligence, particularly for your primary service areas, is your first key consideration. Your second question is, where else can the folks in your market go to get the service? So if there are already health systems or independent for-profit operators in the community who lead the market in terms of pricing and accessibility for one of these shoppable services, it might be worthwhile to focus elsewhere. So again, really the second question there tackles, your respective market's competitive landscape. Third question here is, what are the costs associated with delivery? So whereas, our traditional focus has been maybe more on high volume or higher margin procedures, price transparency begins, to really push towards one market price, and whether that's the median reimbursement rate or not for each of these services. So providers will need to understand that their initial costs, or their internal costs rather, and how can they deliver those services more efficiently, or let someone else provide that service. So what opportunities for efficiency in the delivery of these services do hospitals and health systems have? The fourth question is, what factors affect the consumer experience about the service? So Betsy touched on this a little bit a few minutes ago. What are your differentiators? Is it top quality physicians? Is it lower wait times? Convenient locations, affordability, speedy results, ease of access, of scheduling? Again, you're looking really here in the question for the end-to-end consumer experience. And again, that's really what price transparency is. It becomes about the growth and highlighting consumerism in your market. And for the fifth question here, how can we best align the organization behind the service? This really gets to transformation within your health systems, within your hospitals. So we're looking at a disruption of market demands requires a more comprehensive change to the business model. So instead of finance, setting the rates for contract negotiations, it's imperative that market analysis and planning data also be incorporated into that. So really, health systems need to break down the silos and align for the best results as it relates to contracting moving forward. So those are really 5 key questions and a little bit of color that hospitals and health systems should be asking themselves right now. As far as what hospitals should be doing to prepare, there's 3 sort of key tactics here, right? So know how your rates compare, know your market, and know your hospital. So in regards to how your rates compare, understanding the reimbursement rates in your market as it relates to both inpatient for the DRG and outpatient for CPT HCPCS codes. It'd also be nice, I'm sure, to have some physician service line by specialty breakdown. I think the one key piece here as far as knowing your rates is really making sure that the market information you're using is local and accurate. So if the accessibility that you have is only at a state level, there may be some variation between what you obtain from the state level data and your specific service area that you're looking at. As far as knowing your market, not just understanding market volume and the projected growth rate of those services, but also understanding traditional and non-traditional competitors. Again, we're seeing growth of these non-traditional private equity-backed competitors for a service such as imaging pop up in a lot of markets at a very low price point. And then also knowing your market now really means knowing your consumers. What demographics, what's important to them, how do you retain or attract them if you're not attracting them right now? And the third question here or consideration is knowing your hospital. So the efficiency, is there efficiency opportunities in providing these services? Importantly, what's the most optimal site of service for this shoppable service to be delivered? So optimal site of service in relation to cost for the provider, as well as availability for the consumers, is key, as well as the opportunity to potentially scale if you do land on the right opportunity. So how do you become a market leader in this sort of changing landscape with more consumerism and price transparency? So as we get to that point, just digging in a little bit here on this slide about knowing your market, Betsy referenced earlier using some of our methodologies as it relates to behavior and getting to know consumer behavior in your particular markets. So this really is an example of taking that information, and really their first step here in the sort of the circle chart to your left is looking at the insurance coverage for a specific zip code, right? So then you start with your sort of current coverage percentages, and then looking at what that proposes to be 3 to 5 years down the road. So what are the estimates of where the landscape in insurance is changing in your respective markets? And then once you're able to do that, then you can really start to try to dig down into sort of clusters within these zip codes within your market. So once you can cluster, as you can see here to the right, you can start to really dig into some of the potential behavior and behavior profiles of some of your consumers. Really looking at what consumer behavior impacts and on what they expect from you as a provider and how they prioritize their own healthcare needs. So really getting into knowing your market down to a zip code level, knowing the behavior of the consumers in your market, again, to continue to retain them or attract the ones that you're not attracting right now. This snapshot here on slide 17 is something that you might consider, as you're looking at your reimbursement rates in your respective market. So in particular, we mentioned earlier that you would want to see this both from an inpatient or DRG standpoint, an outpatient, CPT HCPCS level, or a physician subspecialty. So this particular example digs into your outpatient CPT and HCPCS level of detail. And what you can do is really take your top, whatever, 5 or 10 commercial payers for your respective hospital or health system and really see how they compare to the market rate. And your market, in this case, could be for your CBSA or your MSA, or even the state, depending on what you want to compare yourself to. What you see on the slide here in walking through this is that it's a fairly busy slide. I just want to call your attention to the top right. In this particular case, this hospital wanted to see how their rates would compare if they were all the 75th percentile for their market. And the particular service line is in the blue box to your top left. And in particular, not going into great detail about some of the other dynamics in the slide, but in your bottom right, you have sort of that yellow row. And your last column to your right, your last cell there, shows you what the opportunity would be for this particular hospital if all of their reimbursement rates were actually at the 75th percentile for their market. So there's certainly a substantial upside in that case, and I'm sure in many markets, in particular, you could choose to benchmark to the median or to the 25th or 75th percentile, whatever is consistent with your hospital or health system strategy. But this is something you may want to consider as you're looking at rates across your market. The next slide here on slide 18, really, we've gone through on the prior slides, clustering by zip code. So, you're really getting down to your most granular local level of market intelligence that you can gather. And then the prior slide to this, we looked at, a snapshot of, in that case, outpatient, but we could also look at inpatient or physician specialty to see how your rates compare against your market. In this particular slide, we look really at what is the impact of shoppable services, particularly if you are shifting where you are providing them. So in this example, a health system wanted to understand their market reimbursement rates by the shoppable service and the potential revenue impact of various market shifts due to price transparency. So you can see here on the table to your right, we have the payment type in the left, and then the market allowable payments are broken into three columns. There's the 25th percentile, the market median, and then the 75th percentile. Your top three rows are looking at ambulatory surgery center, combining both the facility and the professional cost to give you a total on your third line there that's highlighted in purple. And then below that, you have your outpatient facility and professional cost. And you can see what the total outpatient reimbursement is across the 25th, the median, and the 75th. So you can see the variation from this particular example of the cost of providing the service in a hospital outpatient department versus an ambulatory surgery center department. So I think for this, really understanding the competition, your current volume, and your market share, the demographics as well as the projected demand informs your decision-making process. So, our thought in this slide is really this is something that, if you haven't done already, you can begin to do while price transparency's final rule is being deliberated and being challenged, in court right now. This helps you to plan potentially of what this looks like if you do consider changing the site of service or the location of where a service is going to be performed. And once you are able to see sort of the revenue shift, what the opportunity is, you can also start looking at some backfill strategies if you are going to move things to a different site of service. So how do you sort of fill the void that you've now shifted the site of service for that particular service? So again, this is really an informed decision-making process, part of the planning process that allows you to figure out if making sort of a go, no-go decision really makes sense here. So again, really wanting to help, the health systems, the hospitals really make an informed decision here. Slide 19 here really looks at the strategic pricing collaborations that may be required. So I think as we think about enhancing or changing the way that we look at negotiating contracts, as we mentioned earlier, it can't just be your managed care folks or your finance folks negotiating these contracts in a silo. They have to have, involvement of your marketing team, your strategic planning team, to make sure that the market data, demographics, and projections of how your market's going to grow really inform the decision-making moving forward. In this particular case, we give an example of how a hospital may decide to expand their outpatient services, in certain areas to capture a price-sensitive millennial population, and how they would go upon doing this. The other point that Betsy made earlier as far as potential market reactions is, is there an opportunity here to partner, looking at new collaboration on how some of these services are provided. Is there an opportunity to partner with someone else that's already doing it in that space? So again, just maybe a little bit of a different way of thinking about how we provide these services. Our next slide here on slide 20, a little bit of a public service announcement on some of the ways sort of that IBM Watson Health is viewing price transparency and sort of how we align our service lines. For this particular webinar and this particular conversation, we really focused mostly on the market review aspect, consumer experience, and the financial models. So under market review, comparative reimbursement rates for shoppable services, market demand, and price sensitivity, we touched on. Didn't touch as much on the clinical performance aspect for this conversation, but under consumer experience, really, taking into account the growth projections of consumer demand for shoppable services. It's one thing to know where your market is today. It's another thing to know where it's going to be 3 to 5 years down the road, particularly as the behaviors of your consumers evolve. And then from the financial models section here, impact of pricing strategy on reimbursement, market opportunities, as well as analysis of shifts of service, which we just touched on really on slide 18. So I did want to, before we pass it back to Abby for the Q&A, I did just want to touch on, based on our second polling question in which we asked, how many of the participants on this webinar have a price transparency or price sensitivity tool currently, and roughly 61% or so answered no, 24% answered yes. So, certainly for those of you that don't currently have a tool, just wanted to sort of introduce a tool that, IBM has that we've used for a while in the payer space, and are really excited to introduce this to the provider space. And we really think, certainly meets the regulation as far as price transparency, and we think it'll be immensely helpful for hospitals, health systems on their journey to price transparency. With all of that said, I just did want to take just a minute to sort of summarize, sort of our thoughts and moving forward, in this sort of, uncertain price transparency environment as we sit here on January 20th. And I think, certainly as we talk to clients and we get questions from hospitals and health systems across the country, really regardless of what your thoughts are on price transparency right now and the final rule, many ways it's already here in some regards. So I think consumers with high deductible health plans, well documented, high percentage of our individuals that are receiving commercial benefits right now. Certain clusters are already shopping for the best prices on services. And it's happening. Those two phenomenons are happening in many, if not most, of your markets right now. So even if the regulations get delayed, it's still vital for health systems to know how your reimbursement rates compare to the competitors in your market. Not only, as we mentioned earlier, does this help with, contract negotiation, but also allows health systems to see where opportunities to expand their market share exist. And sometimes there's a hesitancy to be a first mover advantage, but particularly for certain generations, and it's not just millennials. We did talk mostly, about segmentation about millennials, but Betsy referenced earlier in the Gen Xers as well. It's important to retain and or attract more of those populations, which are your largest commercial populations right now. So I think as you're looking and you're enhancing and informing your outpatient and ambulatory care strategies and meeting consumer demands, it's vital that, if you're not taking action now in regard to consumerism and price transparency, I couldn't implore you more to do so now, regardless of whether it gets held up in court or it gets delayed a little bit. In many regards, like I said, it's here right now, and it's happening amongst us already. So with that being said, I just wanted to transition back to Abby, and hopefully we can get to as many of your questions as we can tackle for the remainder of the webinar. Thank you.
Awesome. Thank you, Jim, and thank you, Betsy, for that fantastic presentation. We're excited to kind of transition now to the Q&A session. And a reminder, you can submit any questions that you guys have by typing them into the Q&A box that you see on your dashboard. And we'll try to get through as many questions as we have time for. I know we have a lot coming in, so we'll try to address as much as we can. And then just a final reminder, too, that you can click that Book Now button that's on your dashboard as well if you would like to schedule a conversation with an IBM Solution Specialist. So let's see. The first question that we have here, it looks like it's a two-parter, so I'll read the question in full first, and then I can address the first question for you. So this question is, how do the regulators anticipate including the specific patient out-of-pocket components like deductibles and co-insurance amounts into the patient price? Also, most hospitals offer financial assistance due to federal 501R regulations and other state requirements. How do these often substantial discounts get included in the patient pricing equation?
I'll take that one, Abby. And it's a good one, and it's important, I believe, to understand that the legislation has two parts, right? So the first is that machine-readable format, and that's all services, the cost of all services. And that price is irrespective of the out-of-pocket. That is really the charge amount that the hospital has negotiated with the particular payer. The second part, so this is where the regulators anticipate including that amount, is the consumer-friendly format. And when we talk about that consumer-friendly, then at that point, that's where the right tool can get access to the patient's current out-of-pocket remaining, deductible, and then be able to calculate for that particular patient what their expected payment amount. So patient payment is a little different than the price transparency we're talking about here. The price transparency is the negotiated rate with the payer, where the patient price is actually something that would be available in that sort of consumer-friendly tool.
Awesome. Thanks, Betsy. This next question that we have here, so this attendee asks, what impact will price transparency for shoppable services covered under the new regulations have on the pricing of non-shoppable services? In other words, will we see a cost shift to accommodate the new market conditions, or is that cost shift impossible in the current market?
Yeah, that's a really good question as well. And I think initially when the proposed rule came out, we did anticipate that there might be some cost shifting, or that might be a possible strategy, given that if you're only going to release 300 of your shoppable services, then your non-shoppable wouldn't be released. However, CMS's most recent clarification on the final rule indicates that all services provided by the hospital, so non-shoppable as well as shoppable, all of those charges have to be revealed in that machine-readable format. So in other words, all prices, all services are included in the final rule as it stands today.
Awesome. Thank you so much. Let's see, this next question that we have here is, how will these new freestanding entities serve those lower income patients who currently receive significant or 100% financial assistance / charity adjustments to their balances?
Abby, this is Jim. I'll take that. I think that's a wonderful question. And, we did highlight earlier that, some of the freestanding entities we're speaking of are private equity backed. So, as far as generally speaking, them serving, a higher need, lower socioeconomic patient population, probably not who they're marketing to, right? So I do think in order for them to prosper, they are going to have to treat that population as well, and not necessarily, just default to the local hospital or health system to provide that financial assistance and charity adjustments. So I do know, some of these freestanding entities are partnering with patient financial assistance tools that allows them to pay over time for these procedures or these services. And I think that's probably their entryway to doing it. But I do think in each of your particular markets, I would pay close attention to that to make sure that there's a good disbursement and variation of patients who are accessing those services at both your institutions as well as at those freestanding entities as well.
Thanks so much, Jim, for clarifying that for us. This next question says, what are the most effective ways to be more consumer-friendly that do not add significant cost?
That I'll take that one. I'll take that one. You know, I think this is an opportunity to become more consumer friendly. And one easy way to do that, obviously, is if we're going to have to invest in a consumer friendly tool, that consider some aspects of that tool that make it very friendly, like above and beyond just giving someone a price estimation. How about connecting to them, to that tool, the ability to be able to schedule an appointment immediately? So helping make the access easy as well. You know, we think sometimes we just think about being able to schedule online as easy access, but to be able to check quickly to see how quickly you can get in, I think that gets into some of what Jim was talking about, and really how do you prepare your organization for this? It's not just being able to schedule an appointment online, but it's being able to have everything in your organization align so that when someone does want to get an appointment, they can get one within the next week, right? They don't have to wait 3 months to be able to see someone. So in order to do that, it looks easy on the front end, but on the back end, oftentimes there's a lot of work that needs to be done within your organization to make sure that that capacity exists, that it's easy to schedule those appointments, and that the whole organization takes a look at the kind of information that is collected up front, perhaps, and try to find a way to streamline that and make it easy to access. So it's much more than just, sort of push a button. It's actually look at your whole organization and transform that to make it more consumer friendly, to be able to access that easily and to get the results you want. I oftentimes
Betsy, can I
compare it? Yeah, go ahead.
I was just going to piggyback. I'm sorry, this is Jim. When I think about that question, and it's a great question to really ponder. Certainly technology is an underlying piece of that, and that's really the complement. But, when you're looking, how you're differentiating and how you're attracting, right? You think of personalization. Betsy said ease of access, right? And the convenience factor. So it's not just enough to be able to schedule an appointment the same day or the next day. It's also how they are greeted when they walk into the office. Is the physician or nurse practitioner or medical assistant, reading off of the EMR versus interacting directly with them, so that, not everything that technology helps, right? But it really is the culture in those particular clinics and those offices that become the real differentiator.
Awesome. Thank you guys both for weighing in. Super helpful to hear from your perspective. This next question asks, what are the best sources for this market allowable payment data? Experiences that this is not readily available.
You want to
so
take
one
that, Jim?
source, yeah, I'll take part of it. Maybe we could tag team it. So, the first source of sort of market, accessible information becomes, your Medicare cost data, which tends to be a little bit, can be a little bit delayed, obviously, as well as some of your state hospital associations have fairly, more recent data sometimes than even what's available from your Medicare cost reports. So those are two, accessible data sets that you could start from.
And then, of course, the information from IBM Watson Health, we have a data store within our market span database that is frequently used to be able to gather that kind of information. So the report that the kinds of analysis and scenario modeling that Jim was showing us was a combination of our reimbursement benchmark data from IBM Watson Health, as well as some state data to be able to augment in terms of volume for outpatient procedures.
Awesome. Thank you, guys. We have a lot of good questions coming in. Let's see. This next one asks, does the payer de-identify which provider for which the prices are posted?
As it stands today in the proposed legislation, they are not to de-identify. It is very similar to the requirements on the provider to be able to release and name specific payers and their negotiated payer rates. So as you can imagine, that is really at the heart and the concern amongst both providers and payers about releasing named contract rates.
Thank you for clarifying that for us. This next question, it says, do you see a large percentage of hospitals not complying and just paying the fines?
I mean, this is Jim. I think, you know, the way that the fine is structured at this point, it's certainly a consideration. I do think, as Betsy pointed out earlier, it is $300 per day per hospital. So if you're part of a larger system, that number gets a lot bigger in that regard. So it is possible that some folks are going to take sort of a wait and see approach, and that's, I think, why we really tried to stress throughout this, and particularly at the end, that the consumerism is already happening in many, if not all, of your markets right now. So regardless of your thoughts on price transparency's final rule, we do need to really be focusing on the end-to-end consumer experience in our institutions. So, yeah, that's my take on that. Betsy, anything else to add?
I imagine also that those who are in non-competitive markets are the ones who are probably most considering, or those who are really they're the only that patients in their market can go to. If they're the sole source, then we imagine that they may choose to take the penalty rather than divulge their rate.
Thank you both. We're going to wrap up. We have 2 more questions here, so we'll finish these up and then close it off for today. This question asks, what can providers do to change these referral patterns?
I think that question was sort of a follow-up to a comment that particular person made as well, which was that it is often providers who, physicians who make referrals for lab tests and so forth. And so patients typically will go where their provider recommends. And I do believe historically it has been that way. I think it depends sometimes on the urgency of the particular test. What we're seeing is a change in that behavior, so that, oftentimes what we're seeing more often is that physicians are recommending a test, and then they may send their patient up either to a referral center or somewhere else that gives them the recommendation as to where to go, so that would be covered under their insurance. So I think there's more awareness of that as sort of a second step. So that's probably important and is embedded in certainly in sort of a procedure that we see in accountable care organizations or CINs and so forth, that they are more focused on making, helping get other folks involved in making that referral. So obviously, physicians are incented to make sure that that patient gets the lab test done if that's what's needed, or imaging or what. So given that we know that a high percentage, if it's too expensive, they may just delay or not get it done. There really is an incentive now for physicians to make sure that they refer their patient somewhere that patient can afford to go. So I think.
Hey, Betsy, just one thing to hop on there as well.
Yeah.
I'm sorry.
Yeah.
Just for your respective care management functions as well, Betsy mentioned earlier, the populations that are most likely to postpone, not even go somewhere else, but just postpone the test. So certainly that informs some of your care coordination, care management efforts as it relates to those populations, because certainly postponing a prescribed service or test is not what you want, obviously. So, making sure that you have some layers in care management, supporting that population to ensure that they are accessing the necessary services.
Awesome. Thank you both so much. This last question here, and then we'll wrap up. This attendee is curious, would I be able to obtain the 300 shoppable services?
Just to clarify, CMS has specified 70 of those shoppable services. The rest, the other 230, the organization, the hospital will need to specify what those are. So remember, a shoppable service is something that can be scheduled by a consumer in advance. So as long as there's a service that's offered by the hospital that can be scheduled in advance by a consumer, then that would be considered a shoppable service to be included in the 300. So there's not a specified list. It's more that you need to look at your own services of your hospital beyond the 70 that are specified to get to the total amount of 300.
Thank you for clarifying that for us, Betsy. Awesome. Before we close out, Betsy, Jim, any final thoughts that you would like to share with the audience today?
Oh, we just want to thank you all for joining in this conversation and for submitting some really very thoughtful questions.
Well, that is all the time that we have for today. So I want to thank Betsy and Jim for your guys' fantastic presentation, and also for IBM Watson Health for sponsoring our webinar today. Enjoy the rest of your guys' day, and we look forward to having you join us for future webinars.